Erectile dysfunction being caused by multiple factors at once. What does that look like for patients, and how can you spot if that's something that might be happening to you? Let's get into it. My name's Luke, I'm the practice owner and lead men's health consultant here at Body Zest and Men's Room Shockwave. We treat tons of men with erectile dysfunction, specifically vascular erectile dysfunction. But what this video is all about is actually how even men who have got vascular erectile dysfunction can absolutely have something else going on at the same time. And when we're trying to diagnose these problems, or even before an official diagnosis, even when as the patient you're trying to work out, okay, what direction should I go in to try and get this treated, you need to first of all just have a rough idea of what is likely to be causing it. And one of the real complicated things which can get in the way of people answering that question of what is causing it is when more than one thing are happening at once. So this video I'm going to talk a little bit about vascular ED and what it might look like when there's actually a combination of another issue at the same time. So what does this look like for you? So men over 40 with erectile dysfunction, the most common cause of this is going to be vascular erectile dysfunction. This is when the blood vessels in the penis have started to narrow, started to lose their health, lost their ability to dilate and hold and sustain blood for the erection. When we're seeing this, it typically goes in a usual pattern of a progressive nature. You know, I just started to notice that I couldn't sustain my erections for quite as long, and then I just started to notice that they weren't quite as hard as they used to be, and then both of those aspects continuously got worse over time. That is a very normal pattern of vascular ED. The thing that can complicate it is if there are other components playing into it at the same time. Now, the most common one to kind of, be combined with vascular erectile dysfunction is psychogenic ED. Now, psychogenic ED, if we take it in isolation, so there is no vascular problem, there's no testosterone problem, there's nothing else, we've just got a problem in our mind, then psychogenic ED is essentially just the arousal process is just not working. Okay, so a message is not being sent from the brain to the penis to tell it to get erect at the moment that you suspect that it should work. Now, what that kind of looks like for people usually is, they wake up and they have a morning erection. They're in the shower and they masturbate and their erections are fine. And then, a few days later, they're in bed with their wife and all of a sudden they can't get it up. That is not going to be a vascular problem because the blood vessels are showing you that they work in the mornings and they're showing you that they work when you masturbate. But now they're not just going to not work at that point of arousal. Something else is likely to be preventing that erection, and it's likely to be psychogenic ED. So we've got those two things in isolation, vascular and psychogenic, but a really interesting component is, well, what happens when they're combined? Now, psychogenic ED can be quite regularly caused by vascular ED. Now, that's not to say that someone purely can only be treated with the stuff you typically treat psychogenic ED with, which is, sex therapy and talking therapy. But it does mean that there is a psychogenic component. So when a man gets vascular ED, then in his head now he is thinking, oh my God, this might not work. Or, once it's up, think, oh Jesus, this might go down. Or before he gets in there, he thinks, how hard is this going to get? Is it going to be worse than last time? All of these stresses are going to interfere with the process of being able to get the erection and sustain the erection. Now, if you go to the doctor with that and you explain, the things aren't working how they used to and I'm stressed and I'm worried about it and then there's a good chance they're going to say, we think there's something going on of a psychogenic nature. And basically that is being told it's all in your head, when actually, in fact, you intuitively might have a sense of, no, there was a problem here before. The same can kind of go for if men have a vascular component to their picture, it started, and then they get a divorce and all of a sudden there's a high stress situation which completely takes away all of their ability to get an erection, during sex. And then it's kind of like, oh blimey, okay, I've got this individual issue. Well, no, there is still vascular erectile dysfunction, it's now that we've just got another component right now which is more severe, and after all of the stress of everything goes away, there's a good chance that you'll be left still with just the same or maybe a slightly worse picture than you had before. All of this is really important because you need to know how to approach it to try and fix it. So if you've had signs of vascular erectile dysfunction and then something else has occurred afterwards of a psychogenic nature, then it might be that the psychogenic component is merely just resolved by resolving the vascular component. So a lot of men that I speak to who come in, they've had a multitude of different stresses because of their vascular ED, because of the fact that they can't sustain a hard erection. And what we'll see is that as soon as we fix the physiological process and the erections improve, the stress about it goes away, and the psychogenic aspect is merely resolved by the fact that we've fixed the vascular aspect. That is common, and that just kind of makes sense, right? Like you would expect that to happen. You haven't given yourself psychogenic ED that is therefore going to be a long-lasting, lifelong issue just because you're stressed about your vascular problem. You fix the blood vessels, and it's very likely that that secondary issue will just go away. If, however, you've got a psychogenic problem first and you've never managed to get it fixed, and then you start to get a worsening of your symptoms because of a vascular issue, that's a little bit of a different story, because the psychogenic aspect is still so dominant that it is still the first place to go and try and resolve. Because if you've got a psychogenic issue and you spend a load of time trying to fix the blood vessels, it isn't going to fix that deep-rooted psychogenic problem if that was there first and it hasn't been fixed by the time you're in your 40s or 50s or older. So I would then say, whatever came first, whatever the most significant thing was originally, that's the best place to start, so that you've then got a clear picture of what's left and what's worth trying to resolve. So another interesting combination from this video, now you've already heard a little bit about vascular erectile dysfunction, but hormonal, low testosterone erectile dysfunction is another one that can be combined because it can kind of come on at the same age. Like blood vessel deterioration is associated with age because of the comorbidities of getting older, increased likeliness for blood pressure, increased likeliness for diabetes, and so on. Having a low testosterone issue is also going to be, typically getting more likely as you get older. Now, purely low testosterone causing erectile dysfunction is a very low proportion of the total instances of the condition, but it is enough of a proportion that it's worth discussing. So let's just say you've had the typical vascular components that are occurring, but then all of a sudden you really start to notice that your libido has dropped and that you haven't got energy. Now, those two things, low sex drive, low energy, symptomatically are the most common things that are associated with low testosterone. This starts to blur some lines, doesn't it? Because it's like, well, am I just not fancying it because I know it doesn't work, or are there actually two separate issues here? And which one is worth fixing first? It's a really good question. I would always say to people that if you suspect that you've got a vascular erectile dysfunction problem and a hormonal low testosterone erectile dysfunction problem, that fixing the hormones first doesn't make sense. You either do them both at the same time or fix the blood vessels first and then the hormones, because your hormones are more variable and can just be improved by a multitude of different things. Like men's hormones go up and down on an hourly basis. Like our cycle, we don't have a cycle. It's just like, you see an attractive woman, they go up. You have a bad night's sleep, they go down. You go to the gym, they go up. Like, it's really, really variable. So what I would say is that there is no point just focusing on fixing your testosterone if you know that there's a vascular problem there, because now you're going to be, aroused and horny and feeling like a man and ready to go, and then just looking down and seeing that you have got not enough hardness for good penetrative sex. So it makes more sense to me to fix the blood vessels, so you get the hardness back, you get the ability to sustain back, and then start to see how you feel. And then you can just start to implement, normal positive lifestyle changes you know, exercise, lifting weights, you know, losing body fat, improving sleep, reducing alcohol, all these things we know that do improve our hormones as men. And we can start to see, okay, as a combination of I'm feeling better about all of this and I've fixed the vascular system, and now actually my hormones are starting to settle and I'm starting to feel better, like that can absolutely happen. And you can just sort of lead to a positive, good outcome from just getting the fundamental fixed. So I think that fixing the blood vessels can lead to lifestyle changes and mood changes which improve hormones, but improving hormones cannot fix your blood vessels, and is actually very frustrating for men who have got a very high sex drive and no ability to go through with sex at the end because of the vascular system. So guys, I hope that helps. Just a little bit of kind of combination symptoms when it comes to erectile dysfunction and, you know, a few of the things which might cause it. If you're a man and, you know, you're over 40 and you're thinking that you might need a little bit of help with your erectile dysfunction, then we're in the South London, Surrey region of the UK. There's always a link in there to have a call with us, and we can just sort of do a little bit of a screening process, see if you're someone that might be a good candidate for the type of treatment that we do. And if you are, we can get you on a call, discuss what treatment plans look like, and kind of move forward from there. But yeah, if you're not at that point yet, but you just want to consume some useful information, you can see that there's a problem, or you want to try and prevent the problem in the first place, then drop us a follow or subscribe, keep up with what we're doing, and hopefully we'll be able to help.